If your bite feels off after dental work and someone says, oh, you'll just get used to it, I want to talk to you specifically. Let's start by talking about what your bite actually is, because I think a lot of patients have never really had this explained to them before. So the bite isn't just about the teeth touching, it's about more than that. It's about the whole system. The way the teeth come together, the muscles that bring everything together, the jaw joints, the temporomandibular joints. It's how the whole system works together seamlessly to allow you to bite and chew effectively. When all these things are calibrated and working correctly, you really don't think about your bite at all. You just chew, you talk, you go about your life. Your brain just registers everything as normal and moves on. No second thought. But the mouth, believe it or not, is actually very sensitive. The nerves around your teeth can actually detect a discrepancy as little as 20 microns. So for reference, the human hair is 70 microns. You can actually detect something that's a fraction of the width of a human hair off in your bite. So what this means for your mouth is that when something is slightly off, a new crown that's maybe a little too high, a filling that changed the contour of your tooth for even just a fraction of a millimeter, or even a new set of teeth on a denture or partial, your brain knows immediately. It flags it right away and starts monitoring and paying more attention to it. That's not you being a problem patient or sensitive. That's just the way your body is designed to detect abnormality. And here's what I want you to understand and really understand and digest it, not just listen and move on. And a bite discrepancy, even a minor one, is something that your body is going to compensate for every single time you bite. So if a crown is sitting a little high, your jaw is going to find a way to change its arc of closure to avoid that early contact. And it's not a major change where your bite's going to look very different, but those muscles are going to change a little bit to alter that path of closure. We're talking hundreds of thousands of times a day. Over days, that's something that can be manageable, but once you stretch into weeks or months, that's something that's going to be an issue. In addition to noticing soreness in the teeth and the adjacent teeth and the jaws, you might start to notice tenderness in the muscles of your temple, and headaches can develop. Over months, you're actually considering the jaw joint itself being affected. The TMJ is a disc joint. There's cartilage in there that can be stressed by chronic asymmetric loading. And it definitely doesn't mean that one crown that's a little high is going to lead to permanent damage. But it also explains why you'll get used to it is not always the right answer. Now, let me describe something and you tell me if this sounds familiar. You had some dental work done. Afterward, your bite felt different, and maybe you were told it was settled. Maybe it was because you're still numb. Maybe it would take some time to get used to. But a few weeks have passed and the bite itself feels a little better, or maybe you've just kind of gotten used to it at this point. But now you're starting to have this tension. You're having jaw tightness in the morning, or these headaches that sit right at the temples right behind your eyes. And you might start to notice an occasional clicking or popping when you open wide. That's actually your muscles and your joints accommodating for this change and telling you that something's off. So when your bite changes, your muscles will adapt. And muscle adaptation, especially when it's compensating for something that's off, brings a lot of tension and potential headaches. The masseter muscle, which is your big chewing muscle right here, is actually one of the strongest muscles in the body relative to its size. So when it's chronically worked at an altered state, it actually holds a lot of tension the same way any other muscle in the body can hold that tension when put under duress in the incorrect format. And the TMJ joint actually sits right in front of your ears. It's a complicated joint. It actually hinges and slides, so it makes it very vulnerable to complications and stress. But here's the good news. The majority of this is completely reversible when it's caught early and addressed. Muscles do release, joints do decompress. The body really wants to return to equilibrium, but it can't do it with that high bite in the way. So it just needs to be adjusted to get back to that harmonious state. And this needs to happen earlier rather than later. Earlier as in within a couple weeks, not months to years. In our office, it's not uncommon to have bite adjustments afterwards, and that's not a sign that something was done wrong. I want to say that again. I think a lot of people are embarrassed or feel like they're being a pain in the rear patient when they come back and want an adjustment. That's not a problem at all. It's part of the process, and I would much rather you come in early and let me address or fix or make one little tiny tweak that solves the whole problem, as opposed to putting up with pain and discomfort. Good doctors expect follow-up. They want to know if something's not perfect. An adjustment takes less than 5 minutes of chair time. We welcome it. We want you to come in, and it makes a world of difference in how you feel afterwards. It's not that adjustments are complicated for us. I really think it's that patients don't really know that they're allowed to or encouraged to ask for a bite adjustment if it doesn't feel right. Oftentimes patients are told to wait and see, but unfortunately they wait too long and they see that it really isn't getting better, and they're embarrassed or afraid to ask for that adjustment. I want you to know you are not a bother. You're one of our patients with a legitimate concern about what was done in your mouth. Going back and saying this doesn't feel right isn't complaining. You're guiding me to get you the right solution. So let's get concrete. Here's what I want you to go back. Immediately, as soon as the numbness goes away and you've had a little bit of time to bite and chew, if it feels off, the next day, later that week is much better than waiting weeks or months or for your next checkup. Especially within the first 2 weeks, if something feels slightly off and isn't improving with time, With any dental procedure, there's always going to be some adjusting, and as long as it's getting better with time, that's great. But if it's not getting better or getting worse, you absolutely want to call us and let us take a look. If at any point you're getting secondary symptoms, jaw pain, clicking, muscle fatigue, don't wait. Give us a call. We'll get you right in, and we never charge for adjustments. So if you're looking for how you can word it or something to say to your dentist afterwards, here's what you can say. My bite just feels different since the procedure. When I try and close together, the teeth don't feel like they meet like how they used to before. I would like to have the bite checked and adjusted if necessary. And that's it. That's all you need to say. And any good dentist will say, come on in right away. Let us take care of that for you. Your bite is one of the most foundational things in your mouth, because when it's right, you really don't think about it for a single second of your day. But when it's off, it can affect your comfort, your sleep, your quality of life. So if something feels off, it felt off 2 weeks ago and it just still feels not right, please come back and see them. And in almost every single case, the solution is a quick fix and is much less complex than the original problem. So subscribe to our channel if this is the kind of conversation you want to be a part of. And if this video described your situation or your experience, drop a comment below. We'd love to talk about it. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shine bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on thoughts, the dumbest you've ever seen.